Did you know that weight-bearing exercises like standing and electrical stimulation may increase bone health following a spinal cord injury? Hi, my name is Anita Kaiser, and this is episode 6 of the Bare Bones podcast, Get Moving and Loading, where we'll talk about therapies to improve bone health. Joining me is my colleague, Wendy Murphy, who has over 30 years of experience living with a spinal cord injury, and our guest, Dr. Therese Johnson, a professor in the Department of Physical Therapy at Arcadia University in Pennsylvania, and Dr. Christine Cowley, an associate professor and director of the Spinal Cord Research Center at the University of Manitoba. Welcome to the show, Dr. Johnson and Dr. Cowley.
Thanks for having me.
Thanks for having me also.
I'll begin with you, Dr. Cowley. For people living with spinal cord injury, especially those of us who already have low bone density, are there exercises or activities that we can do to prevent or treat low bone mass and osteoporosis?
The short answer is yes. Although there are limits to what we can expect to gain from these exercises, which are dependent upon how long you are in your journey sustaining a spinal cord injury, activities like passive standing or electrical stimulation-based therapies can assist in terms of slowing down rate of bone mineral density loss. Depending on the time point post-injury, even people who have sustained significant bone mineral density loss can use therapies such as electrical stimulation-based therapy to improve their bone mineral density status.
For the many listening, in general terms, can you explain how these therapies work, doctor?
Yes. In a nutshell, the regulation of bone density is very much like every other system in our bodies. If we don't use it, we lose it. And people who exercise more have stronger hearts, larger muscles, and typically stronger bones. The difference between bones and other organs and tissues in the body is that bone is very, very slow to improve its density once we become adults. So we don't see changes as quickly as we do than when we're doing other forms of exercise, say, for example, strength training, where we can easily see increases in muscle mass over the course of a few weeks or months. So basically for bone, there's 3 types of forces. Those that are caused simply by gravity acting on the long bones of the legs when we stand upright, which are called compressive forces or compressive loading. And then there are those that are generated by muscle contractions acting through tendons on bone. And these could cause torsion or twisting forces, as well as bending forces. And additionally, the action of 2 muscles that are antagonists to each other, say, for example, your quadricep extensors and your hamstrings, which both act on the knee, when stimulated together, can form a compressive load on bone as well. So if the bone receives signals of these types of physical loading, it responds by changing the balance between bone resorption and bone formation, such that bone formation is favored over bone resorption or bone loss, and therefore it tends to increase bone mineral density. Loading can also slow down the rate of bone resorption, such that you may not improve or increase your bone mineral density, but you might slow down the rate at which your bone mineral density loss occurs.
Thank you, Dr. Cowley, for explaining how that works. So, Dr. Johnson, maybe you can tell us who would be eligible to participate in these activities.
Most people with a spinal cord injury can participate. The SCI can be acute or chronic, or it can be complete or incomplete. So people with ASIA or AIS A, B, C, or D classifications can participate. If neuromuscular electrical stimulation, otherwise known as an MES, or functional electrical stimulation, otherwise known as FES, is desired, the person must be able to tolerate the sensation of the stimulation. If a lower motor neuron injury is present, the muscles likely will not respond to electrical stimulation. This situation most commonly occurs with injuries at the lowest part of the spinal cord. The response of the muscles can be tested to determine if the use of electrical stimulation is possible. Also, anyone with a non-union fracture or significant malalignment of the bones of the leg should not participate in standing or electrically stimulated activities. A non-union fracture is one that doesn't fully heal to realign the bone. These types of malalignments alter the way someone stands.
Now, if we talk about standing for a moment, Dr. Cowley, I know there are 2 types, passive and active standing. What's the difference between them?
Yes, they are different. Passive standing is when a person who has leg paralysis is placed or places themselves in a standing frame, which will then provide a compressive force on their leg bones. And that represents the weight of the body, basically. And this is referred to as passive since there's no active muscle contraction involved. In contrast, active standing occurs when there is some muscle contraction present. That muscle contraction could be voluntary in the case of a person who retains some motor function and is able to contract the muscles of the leg to help them to stand upright, either alone or with a standing frame or other form of body weight support. And in the case of people who have leg motor paralysis, we can use neuromuscular electrical stimulation to cause contractions of leg muscles while positioned in a standing frame as well. Those two forms, where there's an active or a electrically induced muscle contraction, are called active standing.
Okay, so then how long would I need to stand for and how often in order to make a difference or see a difference with my bones?
Well, in the research to date, it looks as though a person would need to passively stand for 1 hour per session, 5 times per week, for at least 2 years in order to see a difference in their bone mineral density. If a person is adding in active contraction or electrical stimulation-based contraction, the time frame to see changes is reduced typically to about a year.
Some interesting insights. Now tell me, is walking better than standing?
Well, anything that causes greater contractions or forces on the bone, provided it's below a fracture threshold level, are going to provide a greater stimulus for bone. When you think about more active muscle contraction on bone, those signals are perceived by the bone in a different way than passive compressive forces that you might receive just by positioning yourself in a standing frame.
Now, Dr. Kelly, I have to ask what might be an obvious question for those tuned in. How can people walk or stand if they don't have movement in their legs?
Yeah, it's a good question. We sort of touched on it before in that if they've got a standing frame, they can then position themselves in an upright manner. So therefore, that's considered standing, but it's passive. And in terms of walking, some people retain some capability for actively contracting their own leg muscles. And if they're positioned in a body weight supported harness, they would then be able to perform some walking function. Research on this is not yet clear whether or not that form of walking actually leads to either an increase or a prevention of bone mineral density loss after injury.
Thanks. This is some great information for our listeners. So I want to switch gears for a minute and talk about electrical stimulation, which was mentioned earlier. And I know that there are a few different types. Can you tell us about them, Dr. Johnson?
Yes, NMES, or neuromuscular electrical stimulation, is the use of electrical stimulation to activate muscle. An electrode is placed over the skin, over the muscle, to activate the muscle underneath. NMES is often used with a goal to strengthen muscles. And then FES, or functional electrical stimulation, is the use of electrical stimulation during a functional activity such as cycling or walking.
In simple terms, can you explain how electrical stimulation works to improve my bone health?
By creating a muscle contraction, a large physiological load is placed on the bones, and Dr. Cowley explained some of this in her earlier answers to questions. Other factors also come into play, such as proteins released by contracting muscles that then can have an impact on the bones. Our muscles and bones do talk to each other, so these muscle contractions are very important to our bone health.
Now, doctor, I actually own an NMES machine, and I'm wondering, how do I get the best results with FES or NMES?
To have an effect on bones, NMES and FES both need to create visibly strong muscle contractions against some resistance. And this resistance can be from equipment such as a cycle, a rowing machine, or a stander. NMES exercises with leg weights can also be performed. A physical therapist or other health professional can set up the parameters for stimulation to achieve the best response for each muscle. And for those of you who understand electrical stimulation parameters, these include pulse durations of 200 microseconds or higher, frequencies of 20 to 33 hertz, and amplitudes up to around 140 milliamps.
Now, how long and how often should I be using electrical stimulation to make a difference?
These exercises should be performed for at least 30 minutes, 3 to 5 days per week. As Dr. Cowley mentioned, bone needs time to undergo changes, so it's important that these exercises are performed for at least 1 year to see an effect. But remember, as with any exercise, it's important to keep exercising to try to maintain the gains or to make more improvements.
So that's a fairly big commitment if people need to travel to a clinic or the rehab center. Are people able to use stimulation devices on their own at home if they're not able to make that kind of commitment?
I agree that this is a big commitment. Some people do travel regularly to clinics, rehab centers, wellness gyms, or community-based gyms. There are people who can get access to the equipment for standing or electrical stimulation to use at home. This access will vary based on country and region and on the payer for health coverage. A prescription from the person's physician is highly recommended and is required in some areas. Some people do purchase some of this equipment on their own, but it is important to consult with a healthcare professional experienced in electrical stimulation or standing to know if it's appropriate for you.
Now, doctor, home therapies are always more convenient, but are there any risks associated with electrical stimulation?
Any intervention has risks, which is why a physician should be consulted before starting any of these exercises. A physician can evaluate risk factors related to bone and order a DEXA scan. Podcast episode 4 talks more about what needs to be addressed by the physician. Since electrical stimulation creates a strong muscle contraction, there is a risk of a fracture if the forces that are created are greater than the bone can withstand. The risks are low, but you should consult with your physician about the status of your bones.
Thanks for this information, Dr. Johnson. So, Dr. Cowley, maybe you can tell us what specific recommendations you would give for maintaining or improving bone mineral density following a spinal cord injury.
If you begin very early after a spinal cord injury, passive standing, when performed a minimum of 5 one-hour sessions per week for a period of 2 years, will slow down the rate of bone mineral density loss that you would have, such that you wouldn't be losing as much bone mineral density as people who don't perform passive standing. If you initiate passive standing in later stages after osteoporosis is already developed, there isn't any evidence that bone mineral density would be increased by passive standing alone. In order for people in later stages of spinal cord injury who have lost significant bone mineral density to receive a benefit of training, it typically needs to involve electrical stimulation. People who have been injured for many years and have already developed osteoporosis, if they use electrical stimulation-based therapy, as Dr. Johnston said, 3 to 5 times per week for a minimum of 2 years in this case, because they've already had substantive bone mineral density loss, they could expect to see an increase in their bone mineral density.
Now I'll ask both you doctors, where can I go if I want to start standing exercises or stimulation therapies?
I'm located in the United States, and access does vary across regions and states. There are wellness centers that can be accessed that may require a monthly fee. Some community gyms may have the equipment.
In terms of Canada, which is where I'm located, it depends on the region where you live as well. And for example, in Alberta, there's been a fairly good expansion of FES cyclers in the province, which can be accessed at various YM or YWCAs when done in concert with a prescription from a physical therapist. And in other regions of the country, there may be places like First Steps where they would have an FES cycling machine where a person could have access to it. And in rural or other areas, there is obviously less access to this type of equipment. But speaking to your primary care physician or going to your rehab center or going to SCI outpatient clinic is a good place to start. And if a person really is in a rural area, bringing along the PVA bone guidelines is also a good starting point, because the professional you may be speaking to may not have a great deal of familiarity with this concept.
So as a final recap, what would be your take-home message for our listeners?
Exercise is good for you, but passive standing and electrical stimulation-based activity can increase bone health in your legs.
Thank you, Dr. Johnson and Dr. Cowley. So if you found today's talk interesting, check out our action planning tool on the website at www.scifragments.ca, and feel free to send us your feedback using the survey provided on the website. In the next episode, we'll talk about drug therapies.